doing, son?
Heart.
What happened?
Pop in the knee.
You got popped in the what?
In the knee.
Oh,
Yeah.
that was a nice game. It was a nice game, though. How's he doing?
Well, he's not in pain right now. We're trying to control his pain. That's his nurse. And I'm working with him in that department. And this is his physical therapist right here.
Hi, honey. Nice to meet you.
And this is his Dr. Mann.
Dr. Mann?
Uh-huh.
Oh, nice to meet you. Hey, we're around, sir. Nice to meet you. Nice to meet you.
Mm-hmm. And that's the social worker, Miss Loretta.
Miss Loretta?
Nice to
Oh,
meet
nice to
you.
meet you too, Miss Loretta.
Mm-hmm. You are just in time. Actually, we were about to have a meeting and discuss what we're going to do with Mr. Rayshawn right here. This your little girl?
Oh, yeah, this is Star.
Okay, hey Star.
How
How you doing?
Star?
Okay, you're going to help your brother at home, huh? Okay. Well, I, as his nurse, is like his primary person that sees him all day. I am the main person that's taking care of him. I mean, you know, physical therapy is important, and I'm going to let her have her moment, but as his nurse, he really needs me I'm at his bedside. I'm the head one that's looking over his care.
Right.
These other people are important too, but I am his nurse.
Oh, okay.
Now y'all can say what y'all have to say about that and put y'all 2 cents in about what y'all want to say about my patient.
Well, I'm his physical therapist. My name is Mrs. Veronica Thomas, and I really think that Rayshawn needs a lot of physical therapy, and I think that our main objective is him getting out of the bed and getting back on his feet and getting back to the activities that he's used to doing.
Oh, really?
Yes, and we're not going to use medicine as a pacifier to create his pain, but we're going to work through his pain.
Oh, okay.
That's my suggestion.
Well, Doctor, what you think about that particular?
Well, I'm the head of everything, so.
Well, doctor, I think that you have to be aware of what I'm saying when I call you to give you the advice on what I think you need to be doing with my patient. So there you go. And he got a social worker back here too.
Hi, yes, nice to meet you again. Now, my primary concern for Rayshawn and the family as a whole is when he gets home and gets turned loose from the doctor and the nurse and his physical therapy, which may very well continue at home. And if the home does not have the equipment, so to speak, or may need an extra hand with home help nurse for a little while, and whatever maybe, you know, the family may not have the ability to finance certain things, that's when I come in and we can come together with a plan, an objective plan that can suit your financial abilities as well as what we can do, whatever we can do to help.
But you do understand that we need to get him better here first before all that comes into play.
Ma'am, we
because
do.
I'm his head nurse.
Yes, ma'am.
I'm the RN for him today. And I am the one that is here with him for 12 hours. So I know what's going on most of the time with him.
But may I say something, Nurse Moon? You're only here to dedicate to his needs, check blood pressures, and give him medication. I'm here with his physical therapy, his physical abilities, to get him out of bed, to get him to walk and motivated again. And I think that's very important also.
Yes, that is very true. And also, we're not looking for him to have a very long stay here in the hospital facility. We're trying to, like I said, when he gets home, what we can do to better his progress at home, because that is the main objective, is to get him well. And you do provide a very great service, as well as you and you too, doctor. But our main objective is to get him at home. And once we get him at home, sir, you know, then we can just, you know, hopefully he'll heal. He'll be back on the football team. He may be able to go to a couple of his games, you know. So that's just where we're coming from over here.
Well, okay, well that sounds good. Now, doctor, as you were saying, what was you saying again?
I said I'm the head. But I mean, I'm going to listen to them some, what they got to say, because I'm sure it's all important, sir. But, you know, we're gonna try to work together to meet his needs and everything.
But I have a question, if I could please. Could I please speak with him, since he's your patient now?
That's exactly what I was about to say too, Miss.
You know, Rayshawn, how do you feel about everything that's going on, sweetheart? Do you feel like that what we're saying is to benefit you? You do? Do you have any opinion? Do you have anything you would like to say?
You know, this is like the most important
Yes,
sir,
see,
that's your
it's very,
son.
it's very important.
Yes.
It's not, with the RN, the physical therapist, or the doctor, it's all about Rashawn.
That's true. That's true.
Very
He is
true.
the patient. Without him, we won't have a job.
How do
Exactly.
you feel?
Why do
I
you
have
feel,
6
right?
kids at home and we must provide.
Yes, we must.
Well, how do you feel, son? How you feel about that? I mean, would you rather be home? Would you like to stay here a little bit, or you think
You
you
stay here as long as till you get better.
Yes, that's right. That's right.
That's right, but we want you able to get back on that football field with your friends and get back in school and get your education.
That's true.
We're going to get you back on your feet and running that football field again.
Mm-hmm. Be sure. Yes, we are.
And sometimes our nurses get a little attached to the patients.
Yes, they do. Yes, they do.
And it's sort of hard being a young person. We understand Miss Moon feelings with that, but
Right.
Okay.
Right.
okay,
Well, I guess I can understand where all of you guys are coming from and see that this is all a very important part of his holistic care. So I'm going to do some thinking and revamp some of my thoughts and try to see maybe if I can come to grips with some of my own ideas and thoughts on how you guys play a very important role in this whole patient care here that we're going to be giving to this little fella here. And then maybe we can get him out of here.
yes, back home with your little sister, Star.
Yes.
Star, you ready for your little brothers to come home?
But I will say this about the nurse. She has right to feel that way, being that she is the one that spends the majority of the time with him.
Exactly.
And not only does
Y'all
that
are
say,
so
not
nice.
only saying that, that also shows just what kind of a wonderful nurse she is.
Exactly.
And so that I
Y'all
will
are
give
so
her.
nice.
Exactly.
You're very welcome.
So that includes